Hi, everyone. Just want to introduce myself. My name is Eliana. I'm a long COVID patient of over 5 years. I first got sick at the beginning of the pandemic in March of 2020 before vaccines. I was severe for a couple of years. And while I now consider myself mild to moderate, it's still very much a big part of my life. I am currently a grad student at Stanford in the MBA program, and I'm focusing on healthcare entrepreneurship. I also create chronic illness related content on my TikTok and more recently on my Instagram. And I'm really passionate about empowering patients to play a more active role in their care. So that's why I'm really excited to be here, and I'm really excited about rhythm intelligence. And with that, I will kick it off to Dr. Curtin to introduce herself.
All right. Thanks, Eliana. And I'm Dr. Jen Curtin. I am one of the co-founders of Rhythm. I have a history of being a complex chronic illness patient myself. So well, even before I went to med school, I had ME/CFS, undiagnosed POTS at the time, immune deficiency, I'm hypermobile, kind of got a lot of the things that I've ended up treating. And so, kind of going through training as both a patient and a practitioner in training, I got out and have been treating folks with these conditions ever since I finished my residency. And I was lucky enough to be invited to the ME/CFS Clinician Coalition to help write some clinical guidance around how to manage the condition. And then when the pandemic kicked off, already there's a shortage of providers who know how to treat these conditions or even know what they are, because most med schools don't even teach about them. And of course, long COVID, relatively newer, so isn't in medical training. So I was very concerned, as were a lot of folks, that what's going to happen if even a small percentage of people get COVID and then develop these infection-associated chronic conditions that we don't have enough providers to manage. And so I co-founded Rhythm to try and basically set up a care platform that we could eventually scale to more people. And, obviously long COVID exploded, and there's so many people around the world affected by this. I think it's just timely. And we know that, the care is expensive, so we're always trying to get the cost down. And this is one of our big steps towards that is, how do we get the expertise out there? How do we get information, empower patients, no matter where they are in the world, to be able to find treatments that may be helpful for them, to find testing, to find insights, so that they can move their care forward, regardless of what they've got in terms of support around them.
Awesome. Thank you for that. So with that, I think today, the agenda for today, what we're hoping to cover is not only the inspiration behind the platform and how it works, which I think you touched on a little bit in your introduction, but also to share patient testimonials. We have a few patients who have generously offered to share their experience with us. They're live on the webinar now. And then followed by a demo of the platform, and then finally a Q&A where you guys will get to ask Dr. Curtin any questions you may have. Just a heads up that I personally have a hard stop at 2 p.m., but the webinar is slated for 90 minutes. So if you see me jump off of the call, just know that Dr. Curtin will still be here and still available to answer any questions. All right, so let's get started with some of the questions. So starting off with the most basic one, and again, you did touch on this a little bit, but are you able to share sort of the inspiration behind why you wanted to start the platform, and how everything just sort of came to be?
Yeah, so I think I touched on some of it already, where the pandemic was the big impetus to really get this kicked off, just thinking, oh gosh, there's going to be a wave of people who need this kind of support. But the other thing was just having gone through the journey myself with several of these conditions that weren't even diagnosed in medical school. Like some of them were even diagnosed after. It was, gosh, what do I wish existed when I originally got sick? And so trying to build that platform, build that model, that world where it didn't, take 10 years to get diagnosed with, X, Y, or Z. Some of these conditions, like the hypermobility I had my whole life, and, also the primary immune deficiency I had symptoms of even back when I was 2. So it's like those things took forever to get diagnosed. How can we shortcut that? How can we get that time to diagnosis way down for all of these conditions that, clinicians aren't really that well trained in? And then how can we make care accessible to more people at a price point that folks can afford? So that's really where the inspiration came from, what we're trying to do.
That's awesome. Just quickly on a personal note, I've talked about this platform a few times because I've been lucky enough to be a beta tester as well. And I've often said that this is the tool that I wish existed 5 years ago when I first got sick. And again, I have some friends who are in medical school or have graduated from medical school or in residency programs now. And I remember early on in my illness reaching out to them and being like, oh, I just got diagnosed with POTS. I just got diagnosed with ME/CFS. And most of them were like, well, I don't know what that is. So, and that was that was really discouraging for me. But all the more reason why we really need tools like this. So that's kind of the perfect segue into the next question, which is, can you explain what the tool actually is? Like, what does it do? What sorts of functionality does it allow for users?
Sure. So the tool actually has a lot of functionality. So it's almost a little bit like it's a lot of functionality to take in. So I'll kind of break it
Mhm.
down into sections. So one thing is that it tries to get all of your medical records into one secure spot. Because a lot of us, we've seen hundreds of doctors, all over the place, and our records are scattered all over. I know some people are really diligent about keeping like a binder and they keep all their records together. What this platform does is it has like an optional electronic records connection system. Well, it'll pull from whichever clinics that you've been to that are on like the health exchanges. And so it can bring that in to at least save you some of the time of having to manually upload everything. But it's not going to necessarily pull from smaller practices that maybe aren't using Epic or Cerner or some of the big EHR companies. So there's manual upload. So that part is to kind of like, hey, get all your stuff into one place. It's HIPAA compliant, it's secure, we don't sell the data, and have a home for it. So that's one big feature. The second one is that based on the information you put into it, the system gets smarter and it gives better and better suggestions. So what it'll do is it'll summarize your case based on what information you've given it. So it can create like a summary for you. And that can be really helpful in terms of, let's say you're going to see another clinician and you're like, hey, I have to summarize, like for some of the ME/CFS patients out there, it's like, I got to summarize 10 years of story for this person. How do I do that succinctly and not leave any key information out? So it can help with that. And then it's trying to kind of share out expertise. And so what we do is the system has like 700 plus, we keep adding more and more research to this, and it's curated research. So we're picking the studies that are good for these areas. Like we didn't put any studies in that looked at gradated exercise therapy for ME/CFS because even though there are a lot of them out there, many of them are extremely flawed. And that is not a recommended treatment. So we wanted to make sure that is not in the pool that the AI pulls from. So curated research, we add to it every single week. We update it with new papers that have come out. And what it does is it then cross-references for you and shows you not only kind of like the latest research related to your conditions, but it's also going to give you hypotheses. So like, hey, given what's going on in your case, here's what you've already been diagnosed with. Here's the remaining symptoms you have. What might be going on in your case? What are the potential mechanisms for why you may still be symptomatic? And then what are some treatments that may actually help you based on the literature, clinical guidelines, et cetera? And then what are also some non-prescription treatments that may help? Lifestyle and diet type interventions? And then what are some additional workup? What additional testing might be helpful in terms of clarifying what else might be going on in your case? So a lot of that is in that health roadmap that this system generates. And then, so once you kind of have that health roadmap, it's saved, you can always regenerate it as many times as you want with additional information you may add, et cetera. And then there's a chat, which the chat is informed securely. It is HIPAA compliant. It's encrypted bidirectionally, zero retention API endpoints. So it doesn't store your data in the LLM servers. It's wiped. So basically what happens is you can chat with it and it knows your story. So it's like, okay, can you trend my labs for me? It'll help trend your labs. It's, hey, my doctor is struggling to write me a disability evaluation for this. Like, can you draft a disability letter knowing my case that I can share with my doctor to save them some time? It can do that. So there's a lot of cool things that it can do. You can also access a lot of the Rhythm Direct medications. Those are through the platform. You can still access them there. And also, we've got lab testing that you can request and consultations you can request. Those are coming soon.
Very cool. Okay, you're right. It does seem like there's actually quite a lot of functionality.
There's so
Okay.
much in there.
Yeah. So what I'm hearing, if I can try and distill this down, what I'm hearing is there's a medical records piece, so I can upload all of my medical records. There is a diagnostics piece, and then there is sort of like a suggestion engine based on those two prior pieces, and then there's like a curated research piece, plus a lot of other things in the mix. So I guess the best way for patients would be to just kind of hop in and just start exploring and get comfortable with the tool to sort of like familiarize themselves with all of this functionality because it is a lot.
Yeah, it's kind of like a Swiss Army knife. Like
Yeah.
it's got a lot of tools in it. And
Mhm.
we know that everyone is coming into this tool at a different point in their health journey, right? Like some
Mhm.
people may not have a diagnosis yet. Other people may have been diagnosed with four different things. And other folks are kind of like, I have one diagnosis, I suspect I have others, I have very little testing done. It can kind of meet you wherever you are. And that
Okay.
was sort of the goal is whatever tool you need, it's got it in there. We just need to be we're working on better ways of guiding people towards like getting them to the tools that will be most helpful for them in the platform because we know it's a lot right now.
Yeah. Yeah, that's great. Okay, so far we've kind of covered the inspiration by the tool, which is the before, the now, like what the tool can do right now and what is kind of like imminently in the pipeline. Now I'm curious, before we get into like the more tactical, if you could share a little bit about the future vision and the aspiration for where you want this to go long term.
Yeah, long term. So one thing I really want to do is, you know, essentially aggregate treatment outcomes from folks, self-reported, but people reporting, hey, I tried this. This worked for me. This didn't work for me. I used it for long COVID or I used it for ME/CFS or for POTS. And basically kind of aggregating that data and starting to look at, are there any things, features, lab tests, anything that can actually predict who's going to respond best to which treatment or treatments? Because that's a big struggle right now in these conditions. There's no FDA on-label treatments for ME/CFS, for long COVID, et cetera. So there's a bunch of things you can try off-label, but it's always this struggle of trial and error. Okay, let's try this one, and then this one didn't work. Let's try this next one. And it's certain things will work for certain people, but then completely not work at all for somebody else. So it's like still figuring out how do we predict so that folks don't have to trial and error as many things before they find something helpful. And that's really the dream here is to be able to gather enough of that data to kind of like, let's predict this and let's share it with folks so that that journey doesn't have to be so brutal and so long. Um, yeah.
Yeah, that resonates with me hardcore because, like I said, I've been a patient for 5 years. In the last year or two, I have moved into mild to moderate from severe, and that was because of a multi-year journey of trial and error. And I remember when I first started to figure out the things that clicked for me, I was so excited and I wanted to share it with the whole world and, talk to my friends in this community and say, you need to try XYZ. And was actually quite disappointed and discouraged when I found that things that worked amazingly for me did not work amazingly for other people. So we do, for this set of complex illnesses, we do need something that is much, much more tailored. And anything that can sort of bring that timeline of trial and error from 5 years to 4 to 3, whatever, I'm sure would just make an enormous impact. Okay, so I would love now to move into, tactically how the platform works. So one question that I think is important is obviously there are a lot of AI tools out there right now. So if I'm a patient, I'm probably, and I am, I'm probably wondering, how, if I have ChatGPT at my disposal and I have Claude at my disposal, how is this different? So if you could share a little bit about how this is different and better than those tools for our patient population, that would be super helpful.
Yeah, so one thing is like the security around it. So if you
Mm.
just load your information into like ChatGPT just as it is on your computer, it's especially like if you include your, it's got your name and everything on it, then technically that's going into, OpenAI's servers. It's not HIPAA compliant. So they're not respecting like privacy per se, because it wasn't really designed for that purpose.
Hmm.
So they may end up training their model using your name and your personal information, which just me personally, I wouldn't want that done with my medical records, of which
Yeah,
I have
same.
very
I'm agree.
extensive
Yeah.
records, so I'm kind of like, okay, I mean, you can kind of, instead, you could maybe screenshot and leave your name out and feed it into GPT. But the other thing is sometimes like you can add documents, but let's say you have, you know, several hundred pages of records, you may end up kind of going outside either the context window or depending on how you're loading it in. You would kind of need to develop a different system for it to access all of your records as opposed to just a small fraction of
Yeah.
them.
Mhm.
So our system is able to look at all the records. So, it doesn't matter if someone's got th thousands of pages, it'll still be able to look through all of them.
Yeah.
Um, and, ours is HIPAA compliant. So what that means, what does HIPAA compliant mean? So essentially all the partners that the data goes to. So for instance, like using like a Claude or an OpenAI, you use different access points to the LLMs that are specifically for privacy related concerns, where they don't store any of the data that goes in there. They wipe it afterwards. And then also, they don't train anything on it. It's just there just to get the response, send it back. It's encrypted in both directions, and then it's cleaned off their server. So that's like a special thing that's done through HIPAA compliant arrangements. That's not just kind of on your base level like GPT or Claude.
Okay. Okay. That's actually really helpful because I know the data privacy piece is really important to a lot of patients, not just myself. So thank you for clarifying that. And that segues perfectly into my next question, which, if there's anything else you want to add, but the next question was going to be, what data are you using to guide patients and how do we know that it's reliable? So obviously there's all the data that I'm uploading from my medical records. Is there anything else, anything supplementary that you want to touch on?
Yeah, so we included a lot of clinical guidance around these conditions, and we included them from like reliable sources. So that's the thing too, is that the data we use that we fed to the system is curated in a way that you don't have things like GET or CBT showing up for ME/CFS. Like it was interesting. I was actually on looking at Open Evidence, which is another kind of like AI tool that's mainly geared more towards clinicians. But I looked up what's the guidance for ME/CFS. I was just curious what it was going to show. And
Mhm.
the open evidence one showed GET and CBT. And I was like,
Mhm.
oh no, like why is that coming up? And
Yeah.
it's, if you look at it, there's so many papers that were on that's in the AIs that they use. And the problem is that is not actually what's recommended. So we're like, all right, we need to make sure we put in like good evidence that's run through clinicians who've actually treated these conditions, who in this case have had these conditions and lived through them, to make sure that it's only looking at good research. It's not looking at stuff that is flawed or incorrect.
Yeah.
Um, yeah.
Okay. Yeah, that's awesome. And yeah, I mean, I particularly love your research tool, your research corner, I think is what you guys call it. Um, I recently reviewed an article or a study for my TikTok where it was kind of a retrospective where a few thousand patients were asked how they responded to different popular treatments within the community, and GET was actually listed there, but it was listed in that it was ranked all the way at the bottom because so many patients had responded poorly to it. So just a fun fact.
Yeah.
I appreciated that very much. Okay. So the next question that I have here, we did kind of talk about, so feel free to, if there's anything else you want to add, feel free, but otherwise we can move on to the one after that. But the question that I have here are, what features are currently available and what do you plan to roll out? I know we talked a lot about the features already, so if there's anything else that you missed and want to add, then that's great. If not, then I can just keep going through my next question that I have on the list here.
Yeah, so I think just in terms of the features, the chat, the roadmap, the record sync is all available now. There's certain medications that you can request through the platform in states where we're licensed. We're expanding on our licensure to get into more states, but those are all available now. We are looking to add additional medications, lab testing, and consultation. So if it's helpful for us, there's like a request early access button in there. And if you click that, if you're interested in a particular lab test or a particular medication or something, let us know because it actually helps us prioritize which ones we're going to roll out next first.
Mm. Okay, great. Yeah, that's a great way of sort of incorporating patient feedback, user feedback. Okay, cool. So next, I guess it would be helpful to sort of clarify the rhythm ecosystem for us because we know there's the Rhythm Clinic and there's Rhythm Direct, and now you're launching Rhythm Intelligence. So, how do these sort of three entities work together? How are they integrated and how are they differentiated?
Yeah, so we're trying to kind of unify the sort of umbrella so that essentially it's a rhythm intelligence platform, and we've rolled Rhythm Direct into Rhythm Intelligence. So
Okay,
Rhythm Direct now exists within Rhythm Intelligence.
that
It's
makes
just on the services tab within Intelligence. So those two basically have been merged at this point.
okay.
The clinic is still somewhat of a separate entity. Patients can still use the rhythm intelligence tool and bring the suggestions to the rhythm clinicians. We've already got folks doing that, and it's actually really awesome. So we are working on we may integrate the clinic with the platform eventually, but for right now it's separate. And yeah, so basically it's rhythm intelligence includes direct, and then we've got the clinic, which is somewhat separate at this point. And yeah, they're definitely kind of like the clinic's more of like a deeper dive, more one-on-one, and then the platform is more like affordable, more access to more folks.
Yeah, I think that makes perfect sense, especially considering part of the flow of rhythm intelligence, the treatments piece, where patients are directly able to order treatments from what was previously just Rhythm Direct. That all makes sense the way that you guys have sort of bucketed things together. Um, Next, I would love to hear from you. So I consider myself a pretty knowledgeable patient. I like to read a lot of research. I spend at least some time every day reading through long COVID news, plugging into, different communities, hearing what people are trialing, hearing how things are going. Oftentimes I find that I know more than my doctors do, or, I'll show up to appointments with like research and ask them what they think about it. And so I guess the question is for other patients like myself, because I think there are a lot of really educated patients in our community, what can they get from this tool? What additional value can they get from this tool beyond sort of like what they're already doing?
Yeah, so I think like the roadmap is probably not going to be the most valuable aspect of this for those patients. I
Mhm.
think the roadmap sometimes comes up with suggestions that maybe you haven't tried yet or you were already considering and you're like, well, I was on the fence about this. I'm not sure. So
Mhm.
sometimes it ends up being more of a confirmation that like, oh, actually, I guess I'm trying the right things. Like, great, awesome. But really where I think the value lies for folks who are more experienced is the chat. The chat is where you can really brainstorm like anything you want. So that's kind of hey, you've got a hypothesis about this supplement that's, in some very, very unique situation over here, or you want to see how rapamycin might specifically, what would I watch out for in my specific case? Like that's where you can dig in and start to do some deep dive type research and conversations with that AI. So I feel like that would be the most valuable part for them. The other thing too is that, maybe of interest, we have on the treatment pages, it's a little bit hidden. We're trying to make it more obvious in the layout right now, but you can also just explore the data that we have on what's worked for other people, and you can filter to find other people
Mhm.
who are like you, who have similar diagnoses or who are the similar like age range or similar gender, et cetera. And obviously, the more filters you put in, the less people are in that data set. But we're continuously trying to add to that, so that can be like an interesting source of just information too.
Yeah, no, that's really cool. Because again, back in my day, 5 years ago when I first got sick, a lot of this gathering of information, the information was just very disparate, right? It was very disjointed. So I was spending all of my free cognitive capacity in patient groups just trying to gather information on what people were trying and how they reacted to it. So anything that can be done to sort of aggregate that and just make the process more efficient, I'm sure anybody with an energy limiting illness will really appreciate. Um, and I think that's actually that was my last question. So unless there's anything else you want to add for the tool, I think that's kind of the perfect segue into the patient testimonials. So again, unless you want to add something, I'll just jump right into those. So I think we'll start with a written testimonial that we got from a patient called Maya Lindenman. So Maya is not able to attend today because of the severity of her condition, but she very kindly provided us with feedback in written form. So I will go ahead and read that now. Okay, so here we are. I'm just pulling it up. Okay, so pretend I'm Maya. Hello. I'm an RN who developed long COVID in March 2020, along with ME/CFS, POTS, MCAS, and subsequently learning I've had HEDS and curate. I've been bedridden for over 4 years. I've been fortunate to beta test the Rhythm platform. It's such a powerful and needed tool. The roadmap is so helpful to see what supporting tests I may need to get for a more complete picture. Like many others, my case is very complex, and it's easy to get overwhelmed and lost in terms of what to do next. This provides a clear, evidence-based, step-by-step approach to guide care, empowering both patients and providers with knowledge, rationale, and direction. The chat feature pulls from IACC informed, which I think means infection-associated chronic conditions, correct me if I'm wrong, sources, and my personal health information. I recently had a significant change in imaging results. While I was waiting to hear back from my doctor, I was able to use the Rhythm chat to understand how it might relate to my symptoms and next steps. Normally, sifting information through an IACC lens is immensely time and energy consuming, resources I don't always have. The chat feature quickly and very thoroughly brought up evidence-based information and helped me understand what was happening and better flag what I need to prioritize with my doctor. I love that the information that usually takes me weeks to gather is all right there. The research corner has the latest research that's applicable to my conditions with a summary. I'm really excited for the opportunity this brings to so many people suffering with IACs who lack the resources and access to the very few specialized providers that exist, especially those who are rural, bedbound, low income, and/or BIPOC, who typically have less access to high quality care. So I just want to thank Maya for sending that in because I know how hard it is and how time consuming it must have been for her to put that together. But we really, really appreciate it, especially since her testimony touched on a lot of the things that Dr. Curtin was just talking about and that I was just talking about. I see so many similarities between my story in the first couple of years of my illness and Maya's. All right, with that said, would love to hear from some of our other patients that we have here. So Carl, if it's okay, would love to hear about your experience. Oh, Carl, I think you're muted.
I am sorry about that. I was all ready to go. But yes, thank you for this opportunity, and thank you again for the Rhythm team for providing such a powerful tool. I've had a chance to use the. Actually, let me back up for a second. I think we were told we needed to tell where we're from. So I'm from Danville, California, from the Bay Area, and I've been suffering and sick since July of 22. It was when my story started. For me, just my symptoms, just a high level. Maybe some folks can identify it. The beginning of my journey started with a extreme difficulty breathing. It was like an elephant on my chest for maybe the first 3 months of long COVID, and then one day it was like the weirdest thing, I was out walking with my mom. It was a cold night, and my legs went completely numb. And so trying to figure out why is this happening it was scary and all these things, right? So I bounced around a lot trying to find answers. As my symptoms evolved, then I just grew to have MECSF and MCAS symptoms that and post-exertional malaise that was extremely debilitating. So again, maybe some folks can identify with some of this stuff. I've been using the tool really just to help me understand what's happening with my body. I think there's a lot of confusion. There's a lot of different rabbit holes you can go down when you start to ask questions, and especially with the fragmented research that's out there, or opinions, I should say. And certainly within my own personal group, there's a lot of opinions that just in my social networking group that can be confusing, let alone in the medical industry. So it really has helped me keep an eye on the prize, so to speak. I know we've mentioned the idea that the tool, and especially the chat feature, can provide recommendations. What I've found is that it almost is like a fire hose. So I have to relegate or regulate the amount of information I take in. I have to digest it, and then maybe choose a path, and then provide feedback, and it helps me track then how maybe I'm responding to one or two particular treatments, and then use it again to try and then find a next step based on results and that type of thing. So it's just an ongoing supportive dialogue that I can have with the tool that actually is really affirming to what I'm going through, and I find it's very encouraging. So I think that's how I use it.
Incredible. Thanks. Next, we'd love to hear from Erica.
Hi, I'm Erica. I've had slow onset MECFS and autonomic issues for 35 years. My worst symptoms are post-exertional malaise, fatigue, brain fog, insomnia, unrefreshing sleep, shakiness and weakness when I stand or sit upright for too long. I have some sensory issues with light and sound, allergic type reactions to food and the sun and other things. I was officially diagnosed with MECFS, POTS, and mast cell activation syndrome in 2016. With treatment, my mast cell issues got a lot better. My MECFS and POTS stabilized, and I finally stopped getting worse. I joined Rhythm at the end of 2022. I love that it's all telehealth. My medical provider is wonderful. And with some treatment changes, I actually started getting a little better. I've been using the Rhythm Intelligence platform, and it's actually pretty amazing. I wish it had existed at the beginning of when I was getting sick. That patients can now use the platform and enter their data, get the health roadmap, and then try one of the suggested medications through Rhythm Direct, through the Rhythm medication system. Is just, it's a game changer. It really is. And it's, I really appreciate that the Rhythm team is making it more affordable and accessible for patients with these types of chronic illnesses. Even as a long-term patient, I found that the platform is helpful to me. I've tried a lot of different treatments in the past, but even the health roadmap was able to find some new avenues for me to explore. And it's specific to my case, so that's really nice. Since it has my data, it can make it more personalized. I've chatted with the AI about the medication rapamycin, and it showed me bullet points of like the results of the MECFS rapamycin trial, and bullet points of the science of how rapamycin works in the body. And that just saved me so much cognitive energy, because before I was trying to, actually read through the research papers, much of which was over my head. And so this is really nice, to have it more summarized like that. But I can view the sources if I really want to in the AI chat. It's easy to find. So what was also very helpful about chatting with the AI about rapamycin was again, it personalized it for me and things to look for, things to consider. And that was really great. Then the AI helped me generate questions about rapamycin that I can take to my rhythm provider. And actually, I was really blown away by the quality and thoroughness of the questions. It thought of things that I would never have thought of to ask that seemed really important. Anyway, this platform is really amazing. I can't wait to see what it can do in the future. And with everything I've gone through over the decades, I hope that my data and experiences can be used to help other patients who also use the Rhythm Intelligence platform.
Thank you, Erica. That so much of what you just said resonates with me. And, when I was pretty severely sick, I used to rely on my partner a lot. If I didn't understand a research study, I would just email it to him and have him read it and, spell it out for me in plain English. I used to have him help me draft questions for my doctor's appointments and be in the appointments with me and advocate. And the reason I bring all that up is because not everyone has that person to be there for them to take some of the load off. And in my opinion, like this is the perfect application for AI. Like this is, if there's one thing that AI should do, it's this. It's helping support chronically ill patients and getting the care that they need. So thank you again for sharing that. Next, would love to hear from Brian.
Eliana, Brian is not here right now. He was going to be a little late.
Okay. Yeah, I was just looking for his little square and I didn't see it. Okay, so we'll leave Brian for if he's able to join later and then just move on to Matthew.
Hi, everyone. My name is Matthew. I'm 29 years old. I live in Orange County, California. I've been suffering with ME/CFS and POTS for about 3.5 years now. Prior to being sick, I was super active. I really enjoyed things like mountain biking, just being outside, being with my friends, rock climbing, anything to keep me active and healthy. And since being sick, a lot of that has been stripped away. I'm not able to do the things that I love, which has been extremely difficult. And really, my identity has changed a ton. Like right now, I really focus on ways to find ways to improve my health, to get better, whether it be researching, reading, discussing with others, things like that. And I came across the Rhythm platform pretty recently, actually, and I found it super, super useful. I felt like my treatment options were really dwindling and kind of stagnating, and I didn't really know where to go, what options to try. I feel like, as many others I'm sure can relate with, you're really the driver in terms of coordinating, things to do, asking the right questions, or bringing things up to your clinician of, options to try. And I felt like I kind of hit a dead end. And so I first started using the health roadmap, and it had some really insightful ideas for me. Like the hypothesis of the root cause was very relevant, easy to understand. And I really kind of resonated with being able to point to something and say, this is actually what's wrong, versus kind of just discounting and almost like an invisible illness. A couple other things that I really learned with the health roadmap was the type of lab work testing that I had previously for things like EBV and HHV6 weren't actually able to show a viral reactivation. And I didn't know that there was a panel to actually show that a virus has been reactivated, such as an early antigen or PCR testing for these viruses, and that potentially could be something that could lead to very specific treatments to help my symptoms. And it also discussed with it things like IVIG, which I've tried to get in the past, which I know has been helpful for a lot of people with ME/CFS. And I've been told by several clinicians that it wouldn't be beneficial for me based on certain lab work, but kind of coordinating everything together and conglomerating it all with the chat, it actually outlined several different reasons why my immune system could respond positively, and it could be super beneficial for my symptoms. So it kind of has helped me prioritize things to bring up to my clinicians in terms of future treatments. Like I didn't understand exactly what I would do if I had a viral reactivation, and I come to learn through the chat that there's a treatment called Valcyte, which is like a targeted antiviral for CMV, HHV6, and EBV, which could be another option. And a little sometimes the lab work was seemed a little bit overwhelming. There's like a lot to do. So you can have very unique conversations with the AI chat of like, if I don't get any lab work, like, is there anything out there that could be beneficial to me? And it kind of can help come up with solutions, such as like it brought up rapamycin, which directly related to the root cause of my illness through that kind of that autophagy, that cleanup and optimizing mitochondrial function, which I really resonated with. So it's really helped me kind of become a little bit more optimistic in my treatment path. It's helped me like get ready for those clinic visits that sometimes can take so long. You want to be so ready for them and ask the right questions that, it's helped me learn and understand and be prepared for those, and really kind of be prepared to take, charge of my health, and really like one of the most important things for me has been like staying optimistic, and it's definitely helped with that.
Thank you, Matthew. I just want to double click on something that you said quickly, the optimism piece, because it's obviously having conditions like this are so tough mentally, and it can be extremely difficult to find sources of hope sometimes. And being able to uncover treatments that you hadn't really considered before, or you'd been told maybe wouldn't work for you, but now all of a sudden maybe they might work for you. Like that's really important. The mental piece is so important. So thank you for sharing that.
Absolutely.
All right. Last but not least, Dale, you're up. Can you guys hear Dale?
No.
Yeah, I can't hear you either, Dale, but you're not. Oh, now you're muted. Do you want to try saying something one more time? See if, yeah, no, we can't hear you. How about, Dale, would you be willing to try logging out of the Zoom and logging back in? And in the meantime, Dr. Curtin, let me know if you think this works, but maybe we can jump over to the platform demo and then come back to Dale's testimony after that.
Sure. Yeah, I think that could work.
Okay.
All right. Okay, so I'm going to jump into a demo. I'm going to share my screen real quick here. Sorry, it's actually not letting me look at what I'm actually going to share here. So I hope this is the correct window because it is actually kind of blank right now. Let me okay, it's actually going to make me log out and log back in too. So yeah, let me let's see.
Try later and just hit.
Let's just see if this
Okay,
works.
we'll just go, if Dale happens to pop in before that starts working for you, we'll just go with whatever is set up faster. Quicker.
Okay.
Yeah.
Let's see. I think this might be working now. Let's see. Are you guys able to see my screen?
Yes.
Okay, perfect. Yeah, so basically what I'm in the initial part of the platform. So this version is a demo with fake patient data. So we're using the case Buzz Lightyear. And so anyway, so I'm going through, I won't be able to do any kind of ID verification because obviously Buzz Lightyear is not a real person. So anyway, you select the state that you're from. If you're from outside the US, please select the international tab. And so I'm going to put California because that's where I am. We've got the privacy policy, security consents here. We also have a special like AI development disclosure. So this is like, hey, this is an AI tool. It's still under development. There's things that are going to be changing. Please don't use it as like a boyfriend, a girlfriend, a therapist kind of thing. That's not really what its purpose is for. And so basically the journey starts here. This is where it gives you just a little summary of what might be going on. And then you can choose to connect your health records. And so if you want, you can skip this stage. This does add some time because it has to sync. Right now, because it takes some time to pull the records, we're only pulling the last 5 years of data because otherwise you'd be sitting on this for like 30 minutes, 40 minutes to 2 hours waiting for it to sync up. But what we're doing is we're going to add a feature later that allows you to pull those further back records. Because we know like the MECFS folks, some of the POTS folks, EDS, you got records that may be from even like all the way back for 10, 30, 40 years. So right now I'm going to do
a question.
Yeah.
So I think I remember the answer to this when I did this myself, but so I did sync my health records, and even if it does take a little longer, you can still move on to subsequent steps in the process and it'll just keep like updating in the background, right?
It will. The only thing is that when it goes through its analysis steps using a bunch of records that you have, those steps may take longer.
Got it. Yeah. Okay.
So you can choose to either skip the records connection and manually upload information. You can still also, even if you connect your records, you'll still have the opportunity to upload manual records just because even what we pull electronically isn't always complete. There may be missing stuff there. So I'm going to go through and click connect records. So start verification and continue. Okay, so actually, you know what? Let me see if I can go back. I'm going to have to skip, unfortunately, just because this will take a little bit too long if I do it. Okay, so I'm going to skip that part for now. So if you go through, regardless, let's say you do connect your records. It does ask for an ID verification, which I can't really do because it's a fake patient. So it'll ask for, it just does like a selfie very easily. And then you just like hold up your ID and it takes a photo of it. And this is just to make sure that you're actually the person you say you are. We don't want you pulling records for someone who you're not. And so for instance, then you're asked what diagnoses have you had formally diagnosed by a healthcare provider? So this is information of what your diagnoses are. Now, I understand not everyone has access to a provider who's been able to make diagnoses for them. So it's okay if you don't have any confirmed diagnoses, that's all right. We ask for symptoms in the next page, and the system's actually really good at picking up what suspected conditions you may have from your symptoms. So for instance, I'm going to do just one here where it's just long COVID. That's like all this individual's been diagnosed with. This is a short list of diagnoses, just common ones in this group. But then down here, there's a little list where there's a lot more diagnoses. So you can add any of them from here. You can search. So for instance, like lipedema, that's in here. You can click to add that. Or let's say you don't see your diagnosis in here, you can add a custom one. and it'll be taken into account by the AI. Okay, so then your symptoms. So this is another short list of symptoms. So let's say Buzz Lightyear has shortness of breath, has some chest pain and tightness, lightheadedness, heart palpitations. They also have like fatigue. They've got PEM and pretty bad headaches. Okay, same thing down here at the very bottom. This is just a short list of symptoms, but you can add any other symptoms. You can search for them. So like, let's say you have ringing in your ears, so you've got tinnitus, that will show up. You can add a custom symptom if you don't see yours in the list. So then I hit next. Okay, and then what it's going to do is it's going to ask you to say how severe are these symptoms. This helps the AI prioritize like which symptoms are the kind of worst ones for you and most recently. So I'm going to say that shortness of breath is medium, chest pain tightness is medium, lightheadedness is severe, heart palpitations are mild, the fatigue's medium, and the PEM is really bad. Headaches are severe. And then this is like one of my favorite questions as a clinician. We call it the magic wand question. And it's basically like, if you had a magic wand, which 3 symptoms would you make disappear first? Like,
Love that.
what are your top 3? What are the worst things? And generally speaking, I feel like folks who have post-exertional malaise as a symptom, usually that's something that all of us want to go away.
Yeah,
So I'm going to pick
give anything.
headaches, fatigue. Yeah. So go through here. Then we ask a couple more questions just for like to understand a little bit more about you and where you are in your health journey. So like, do you have a care team that welcomes your suggestions, or are you kind of doing this all on your own? Things like, where do you have clear diagnoses, suspected diagnoses, et cetera? And are you someone who, Eliana, you mentioned, I know more than my clinicians, I'm guiding them. Is that your case? Or are you like, no, I do a lot of my own research, but my clinicians are still the final opinion. And then sort of like, how urgently are you looking to act on this stuff? If it's like, no, I'm just exploring, or, I really am like, I want to act now. And then what are your biggest barriers to care? This also helps us understand, what are folks' biggest problems who are coming through here so we can tailor the product more to you. So let's say cost and affordability is like the big barrier here. So save and continue. And then basically what you can do here is rate your treatments. Now, it didn't really have anything active to pull from here because I didn't sync records, but you can either upload, and what's cool here is you can actually upload, let's say you have a patient portal with one of your doctors and they have a medication list in there that you can't download. You can just take a screenshot of the medication list image from your patient portal and upload that here. So you go to screenshot mode, and it can even combine screenshots together for you. And then what's cool about it is it can pull out the names of the treatments and list them for you in here automatically. So it makes it easy. Or let's say you have a medication list. If you have a PDF medication list, you can just upload that too, and it'll do the same. And you can also add, manually. So let's say basically I've tried like atorvastatin, and let's say that was like actually like pretty helpful for this patient and didn't really have any side effects from it. And this was like help the chest pain, the fatigue, and some of the PEM. Okay, it's an active medication, still taking it. And let's say also this person also tried Plavix. Okay, so adding that in, Plavix was actually like quite helpful, but had a little more side effects from it than the others. And this was really helpful with like the fatigue, the chest pain, the PEM, and the shortness of breath. And it was used primarily for long COVID. This one's also an active medication, still taking it. And then the other thing is this person also, basically has been pacing. So they've been trying to pace their activities, and the pacing is kind of like, all right, it helps, it's good, no real side effects from it, and using this for long COVID and for PEM. Okay, and that's active. So you can kind of add as many here, but what's cool is that usually what it'll do is it'll actually just pull from your records and it'll list all of them for you. So if you can see here, this is the format in which they would show up. So you can delete ones that show up from your records, because sometimes, stuff shows up that's not really relevant. Like, oh, I, took this antibiotic a long time ago because I had like, an infected wound on my hand or something. You can just delete that one. And then you can go in and very easily just select like boom, boom, like here, here. And if you don't know, you can click the question mark. So then the more stuff you add in here, this is information that then gets like anonymized and put into for the whole community, what has helped whom. And so then the more you add, the better the suggestions get, because then it tries not to repeat recommendations for things you've already tried. Occasionally it still does, but it's getting better at that. So let's say I continue here. And so then with the data verification page, so this is where you can kind of review like which treatments are there. You can also look at like lab testing results. I don't have any uploaded for this because I didn't want to show like real data. Symptoms, diagnoses. If you sync your records, it'll show a bunch of like encounter notes here, and it'll summarize each of the encounter notes so that you can see what's being pulled in. And then you always have the option to upload any lab work. You can upload any treatments. You can add or manage symptoms. So let's say you got here and you're like, oh, I forgot to add that I also have really bad, like, it feels like my head is really, really heavy for my neck. That's a symptom commonly seen in craniocervical instability. So you can just go in and add additional things that, maybe were left out.
Okay, yeah. I was going to say with the brain fog, it would be very easy to miss things in the initial onboarding. So it's very good that things are editable in the future.
Yeah, and the other thing, so this additional notes section up here at the top, there's a microphone over here on the side, so you can either type or you can speak. Because I know sometimes it's hard to type, especially if you have trouble being upright. You can just click this and then you can just talk into your phone on mobile or into your laptop or whatever. So you can speak your story instead. And that's true for all of these free text boxes throughout the entire platform, is that you've got the speak option or type. The other thing too that I just kind of forgot because it was covered by my screen is there's a light dark mode. So if you want to put this in like dark mode, you can. And so I'll actually put it in, put it in dark mode for the rest of this. But so that toggle is right up here. You can switch between light and dark mode. So here, this is where you can kind of look at this data. And so let's say you had a bunch of records pulled and there's like, 800 lab results in here. It'll sort them by which ones are abnormal. And also there's going to be, let's say, a bunch of treatments. You can say, oh, you know what? It doesn't have like my tryptase level was, was X. Okay. You can write that in, or, hey, like this, I had ME/CFS before I got COVID, and then the COVID made it way worse. So things like timing are good things to emphasize with the system. And then once you're happy with it, you can say save and continue. I'm not putting a lot of data in here, so it's just saying that, hey, sometimes if there's not a ton of data, the quality of the suggestions may not be that great. And then it goes through an analysis step. And so essentially what is happening is that it goes through and it looks at, pattern recognition across everything that's going on. It goes through like a clinical synthesis step. And then it starts to generate some hypotheses about what might be going on with your case. And so basically like this part is kind of like a good little break to take like for PEM. So when it's doing the loading steps, it's like, this is a good time to just like relax a little bit, kind of lay down, etc. There's several different processing steps where depending on the records and how much information you put in, these steps may take less time or they may take more time. And so just kind of, these are good little, I just call them PEM breaks while it's loading. So, yep. So this one is working on it. And what it does is it generates the hypotheses that it's coming up with based on what I've put in. And then what it'll do is it kind of summarizes for you what the key findings are. And like, so it's looking at different symptoms that I've put in, like, oh, had a good response to Plavix. And then it's looking for symptom patterns. So it's saying like, okay, there's some neurological involvement. There's an ME/CFS-like pattern, even though this person doesn't have a diagnosis of it. And then, basically it's like, hey, there's not really like lab findings, and then treatment history. And then these are the hypotheses it's thinking about right now. So it's thinking long COVID with ME/CFS overlap, long COVID with some microvascular dysfunction, possibly some POTS secondary to a long COVID, and long COVID with a neuroinflammation component, likely because of the moderate to severe headaches. It also talks about what are other things that could be useful to include. So these are missing tests, and it's like, oh, you know what? Actually, I have had thyroid function tests. You know what? Let me add that, or let me just type that in down here at the bottom. So the confirmed findings is like, all right, is there something that's missing, something incorrect? You can type it in, or again, you can speak it in here. And then you can go through and, oops, sorry, I'm covering the bottom of my screen here with the Zoom. Okay. So save and continue. And then it takes the information that you've given it and it goes through, and now it's searching against all of those 700 plus IACC research papers. And it's essentially going through them to figure out, hey, what's relevant, what's research supported, what might this person have going on? And so it's digging through all those papers and really kind of doing its due diligence there. And then the next thing it does is, as it looks through the papers and compares it to your case, it starts looking for some like root cause analysis. So what might be underlying some of your symptoms or your conditions? Like, could there be something like a viral persistence going on, a viral reactivation? Is there autoimmunity involved? It'll kind of dig through a lot of that and compare it to your case and see what makes the most sense. And then once it's kind of got its set of root causes that it thinks might be going on, it'll then start to rank them by, okay, which one do I think is most relevant? And then it works on generating something called strategic questions. And what these questions are there key questions involved in things like, hey, okay, here's what I think might be going on, but here's some additional questions that I need in order to get a little more clarity on whether or not I'm thinking in the right direction. So this is something that sometimes like clinicians will do during a new patient visit, is they'll think of things like they'll go through your story with you, they'll think through stuff, and then they'll kind of like, okay, let me ask you this specific question. And then let me ask you this one, because it helps them refine what they think is going on in their own head. And so that's what this system will also do. So again, this is a nice little pen break. It's just like, you can just kind of rest, lay down on the couch for a little bit, give it some time to process. And again, this can go faster or slower depending on how many records and how much you've uploaded. So, well, this guy is kind of moving forward. It does take a little bit of time because it is like a lot of this is actually, it's honestly, even though it says evidence synthesis, it's probably still researching the papers. That part takes a long time. So now it goes through and it summarizes here what it thinks root cause might be going on. So it's thinking SARS-CoV-2 viral persistence with some endothelial dysfunction and microclotting. That's what it kind of thinks. And to me, as a clinician, I would think the same thing, because this individual responded really well to atorvastatin, which stabilizes the endothelium. And they responded really well to Plavix, which is an antiplatelet drug, so a blood thinner. So it kind of makes sense that this would come up top. Mitochondrial dysfunction, suspecting a little bit of MCAS with neural inflammation, and possibly some small fiber neuropathy with autonomic dysfunction. These are like hypotheses that are good to like look into. And then it breaks it out and it says, okay, what evidence for versus what evidence against for each of these things. Okay, so I'm going to scroll down to the bottom and you can see some of the literature here, like that it referenced and how relevant it is. And then you can continue to those strategic questions. So for instance, this one right here is asking about post-exertional malaise. So it's like, you know, what's your PEM situation? It's like, yes, I've got PEM. It takes 3 days to recover. And then basically, do you notice that like when you go from standing up to lying down, or vice versa, do you have like issues that are related to what position you're in? And it's like lying down, my symptoms improve. And then this is asking kind of like some neuropathy type symptoms. You have like tingling, burning, electric shock sensation. I'm going to say no for this one. And then do you have any flushing, skin rash, cramping, etc.? And I'm going to say yes. And then since starting Plavix, have you noticed any improvement in your exercise tolerance? Yes. And then do your symptoms have a pattern throughout the day? And I'd say, you know, most folks with like ME/CFS, long COVID really struggle in the morning in particular. So worse in the morning. And then do you have like environmental triggers? I'm going to say no on this one. And then when you have a good day or a bad day, can you identify any potential triggers? And I'm going to say just like overexertion. So then it starts to generate the health roadmap based on those answers. And so it's going through and looking at diagnostic tests and labs, treatment suggestions, and then generating that roadmap. So again, you get another little pen break as it's kind of doing its thing in the background and thinking and working. And yeah, so again, it's just like doing its thing. Just got to wait for it a little bit. And I'll talk about too. So one thing on the data security side, so it is HIPAA compliant. So if there's anyone here who's from outside of the US, unfortunately, outside the US, we don't have connections to the electronic records that you guys have. So like for instance, and it's not like GDPR, it's just HIPAA, but you can still use it and manually upload your records. The other thing too is that you can delete your data anytime from within your health profile. So you can always delete it, and it's like a full data delete. Like we can't, like even if you're like, oh, I don't really like, oh, can I bring it back? We can't actually. It's like completely deleted. So, you know, just for security reasons, like if you want to delete it, you can delete it. Okay, so everything's saved. So the health roadmap, I'm going to go in and explore that. And so basically this is what it's kind of thinking. So it gives a little summary at the top of the case. So this is sometimes helpful to share with like a provider. You can export this to PDF and share it with a clinician, share it with a caregiver, whomever. And so suggested treatments, because again, I didn't really put in that I tried it, tried many things before I put this in. It's starting with more of the basics in here. But if you put in a lot of treatments that you've tried, it will generally exclude those from what it shows you. So it'll kind of like go further and give you like further and further things to explore. And I think you heard some of the folks on the panel had talked about that. So it's talking here about like LDN, ketotifen, maybe midodrine, and then for that's under prescription treatments. So it buckets into prescription, non-prescription, and then lifestyle and diet. So here, non-prescription, it's talking about high dose CoQ10. So based on the literature, actually CoQ10 can be used, but it's usually at higher doses where impact is seen. Magnesium glycinate, this is likely related to the like the headaches, muscle and nerve function. And then there's a high dose B1 protocol, thiamine, vitamin B1. This is actually mainly from more the ME/CFS world, but this I've actually seen be helpful in quite a few patients, to be honest. And then lifestyle and diet modifications. So obviously pacing with some heart rate monitoring can be really helpful. It's suggesting compression garments, increased salt and fluid intake. So this is again for a more simple case. So if you have a very complicated case and you put in a lot of the stuff you've tried, your recommendations are going to look more things like you may see stuff like rapamycin, IVIG, you may see stellate ganglion blocks, things like that. And then it goes through suggested labs. Now, remember, I didn't load any laboratory testing in here. So if you have loaded a bunch of labs, it's going to look through and try to not suggest labs to you that you've already done. So here it's looking at, okay, let's look some clotting labs, D-dimer, fibrinogen, platelet aggregation studies. This is because this person responded really well to Plavix. And then comprehensive inflammatory panel, so looking at certain cytokines, CRP, ESR, a tilt table test to look, hey, does this person have POTS? An echocardiogram, tryptase level and 24-hour urine histamine metabolites. This is for MCAS. You know, 2-day CPET. This is for ME/CFS, but it's not necessarily required. And then just like a CMP with some B vitamins, CoQ10, magnesium levels, just like, do you have any major vitamin deficiencies, which are actually surprisingly common in this patient population. So then you can explore things like the evidence-based hypotheses, okay? So it gives you the supporting evidence and the considerations. There's also a root cause analysis, and this is the part where it tries to explain to you, like, hey, how could SARS-CoV-2 viral persistence and endothelial dysfunction and microclotting, how does that lead to symptoms? Like, how does that lead to my issues? And it tries to explain it here. This part can get a little technical, so, don't worry about it. You can, bypass this, or you can just ask the chat. So you can provide feedback on here, and then you can click over and ask your AI assistant, and it'll take you into the chat where you can start asking about, like, it's got some preformed questions here. Help me prioritize what to talk to my doctor about. And so this can help you write up some questions to take to your next health visit. And it's dynamic. So it's referencing all the things that you've loaded. And then it's like, all right, here we go. This is giving you some things to discuss and chat with your provider about. So it's bringing up like these different treatments to maybe discuss, and like, hey, for mast cell, maybe you want to ask them about a tryptase level in these 24-hour urine metabolites. And then other things you can ask. So let's say I had labs loaded in here. You could ask it, can you trend my white blood cell count over the past several months? And it will do that. It'll actually create a graph for you and do that. If you need help creating like an accommodations letter or a disability letter, you can ask it to draft that, or you can just deep dive down whatever questions you have. The other thing you can do is on the homepage. This is where it's kind of like you can do daily journaling in here. So you can write in, hey, like I had a really bad headache today. And it'll put it into your timeline. And therefore, every time you regenerate the roadmap or use the chat, it's aware that you had a really bad headache today. And it can start to pick out patterns in what may be triggering your symptoms as you log more of those symptoms over time. And again, you can always speak in rather than typing. There's things like questionnaires in here if you want. So like the Compass 31, the FunCap 27 we're adding, there's a bite-in score, all kinds of things. And here's Research Corner. So this is like various different studies related to the symptoms and conditions that I put in. And so for instance, this one on EBV virus with autoantibodies, basically I can ask the AI, so I can see a summary of what the paper talks about. I can go click to view the original source, so it'll link you to the paper. And you can also ask AI about it. It'll take you back to the chat, and it'll explain to you, hey, this is what this study means to your specific case. So it takes a little bit, and then it's thinking. Well, I think it may have actually timed out on here, but I'll go over. So usually what it'll do is it'll reference and then it'll write out what it means to your case. So then the other thing that there is like services. So this what used to be called Rhythm Direct. It's now wrapped in under the services section of Rhythm Intelligence. So this is where the medications are that we offer through like async prescribing. So LDN, metformin for acute COVID, ketotifen, pyridostigmine. There's a few we're working on that are coming soon down here at the bottom. So if you're interested in any of these, just click request early access, and that actually helps us prioritize which ones we're going to bring out first. Supplements, we've got just one right now, oxaloacetate, where we give you a discount coupon for like $100 off. And then labs, we're working on labs that we want to bring out to you guys. So these aren't operationalized yet, but if you're interested in any of them, you can request early access. And again, that helps us prioritize which ones we're going to make accessible to y'all sooner. And then also we're working on bringing consultations as well. There's a feedback section here where you can let us know what we can improve. And if you run into an issue where you need to send us a support ticket, like let's say it freezes on something, you can just click here and basically put in a support ticket, and our team is on it. We'll get right back to you and we'll help you through anything you need. All right, so I think that kind of wraps up my demo. All right, let's see. Do we have Dale back on here? Was Dale able to reconnect?
I think I'm reconnected.
Oh, there we go. Now we can hear you. Yay.
Okay.
All right. I'm going to actually, do you mind if I'm going to try and turn your camera on because we can't really see you.
I'm connected two ways, so.
Okay, gotcha. Well, all right. So I guess, yeah, Dale, if you want to tell us a little bit about yourself and then, your experience using the platform. Oh, there we go. We can see you. Yay.
Okay. Can't see myself, but that's fine. I had a whole speech plan, but I'm glad I get to go last because now I've changed it up completely. Okay, so Dale, I live in Minnesota. I was a neonatal nurse practitioner for my career and lost it all in 21. Not sure when I came across rhythm, but a problem I have is I'm trying to use a lot of apps and they don't integrate with one another. I need to find a way to get all my information consolidated. And I worked several times trying to develop a spreadsheet that I could track everything on and then just upload into Rhythm. And even that was rather tedious. So there's a better way to do it. I just haven't found it. So it'd be fun to talk about that, or maybe I just need to throw away all the other apps that are giving historical and real-time information. I'm in the same ballpark as everybody else in that I clearly know more about the virus and long COVID than any of my providers. And I have now reached a point. So the VA records do not merge with Rhythm. But of course, I can upload stuff, but I got massive amounts of records at the VA. So I need to be more diligent, I guess, about just uploading those. I've got a long COVID provider, a VA provider, lots of providers at the VA. My primary care provider, and I've seen a lot of specialists, of course, and nobody is doing for me what I want done. And let's bring it down to that's causing me to come to a crossroads because the family is saying, would you stop all of your investigating? Would you stop telling people what you want done, what you wanted looked at, what you want treated? And it is what it is. Okay, you are physically fading, mentally, you're fading pretty quickly, and it's time to stop and accept it and enjoy what little time you have left with your grandchildren. So it's quite a crossroads to decide where to go.
Yeah, no, thanks for sharing your story, Dale. Appreciate it. Yeah, so I'm going to jump in and take some questions from the audience here. So now we're in the Q&A section. We've only got a little bit of time left for the questions. So let's see. So sorry, I'm scrolling back through here. I do see one. Is there a mobile version or can we use the browser on mobile? Yes, you can. So it is adapted for mobile. So you can absolutely use it to use it on like your phone or something or on your tablet. We haven't optimized it for tablet yet. But for like a standard kind of smartphone, it should work. And if you run into any issues on it, please send a support ticket and let us know like what part's kind of a little bit funky and we can fix it pretty quickly. Um, And someone said, I presume you'll eventually charge to use Rhythm Intelligence. When is that likely to happen and what model are you likely to follow? So this question's really good, right? It's free. We're always going to have a free tier. That's something we want. It's just like basically we want to have everyone have access to this no matter what your financial situation is and no matter where you are. And so likely what we will probably roll out is that the way it's monetized now is if you get prescriptions or you get like labs or you get consultations through the platform, that's where you would pay for stuff. We may end up adding like a subscription type thing for the AI component only if you're going above like a certain amount of data usage. Just because it does like we get charged based on how much data. So if you're using like a ton of it and you want unlimited queries, we may end up adding something there. But I think that's not going to really apply to most of the folks using it. And then someone said here, can you look at DNA sequenced elsewhere? So we're in the process actually of testing how the system does with genetic information. So for instance, I actually uploaded some of my own genome data and we're looking at things like how well does it do with pharmacogenomics data and things, which that's like, how do you metabolize drugs based on your genetics? And so we're still testing that to see how well it does. So it's something you can upload. I can't guarantee that it's going to do a good job with it. But if you wanted to try and see what it spits out, please let us know. Keep us posted on that just so I can so we can like help figure out like, okay, is it doing a good job? Is it not? What's it finding for you as we do our own testing on our end as well? So thank you for that question. Let's see here. I think someone mentioned, asked if it's available for children. So one thing we are working on is we know that there's a lot of you who have kids who are affected with these conditions, and the kids might be fairly young, so they may not have like an ID or anything, so they can't really do the ID verification to pull records. This is something we're working on and we're thinking about because we just have to make sure that it's secure, that like the right person is pulling their records. So please reach out to us on our contact us page and like let us know if you have a kid that you want to be able to enroll through. The more demand we get for that feature, the higher a priority it becomes for us to add it. Someone else said, um, I'm so impressed and appreciative of this work. This technology has obviously been developed in such a patient-centered way. How do you avoid AI hallucination? So it's not entirely perfect that it doesn't hallucinate sometimes. So there are some issues, which is why we always say this isn't a replacement for a clinician. You want to run it by your team first and kind of like, you can re-ask the question a couple different ways sometimes in the chat too, to see if it keeps answering the same way. And so we're working on ways of reducing hallucination, which some of that is you actually have two models talk to each other before it spits out an answer, but these are all things that are like still in development. Let's see here. And then someone was asking about long Lyme. So long Lyme worsened by COVID. Will these resources used be able to help? So we are actually in the process right now of uploading a bunch of literature on long Lyme disease and Lyme disease in general and Lyme disease and its co-infections. Because basically there is some research that I think David Petrino talked about in a recent like roundtable where they're finding kind of reactivated or unmasked like Babesia and Bartonella infections in folks with long COVID. So we're in the process of adding that. And then let's see here. And then, okay, somebody from abroad is asking, how do you enter your physician letters and lab reports, etc.? Yes, you can drag and drop, or you can just click the upload button, and then you can just select from the file sorter on your computer. And it does have multiple file upload. So for instance, let's say you have a folder with all your individual lab reports in it. You can actually just select the folder and all the stuff in it, and you can upload it, and it'll just batch process it. So that's to kind of help make it a little bit better. And then do you look at gender in research? Much is based on men and not that helpful to women. So yes, that is so true. And especially in these conditions, like Akiko Awasaki and her team have been finding some interesting differences between men and women in like the long COVID space. There's data on some of that from MECFS, et cetera. So what we have is we have the studies in there. So we look at, for our end, we do look at gender differentiation. However, in the research, we're trying to include papers that have looked at gender differences and things like that in these conditions so that the AI can actually pull from that and keep that in mind as it's analyzing folks' cases. Okay.
The question is it restricted by state and what about international?
Okay, and so is it restricted by state or is it available internationally? So the AI components, like the information, that is available everywhere. So all over the US, international, it's HIPAA compliant, it's not GDPR. It's just like, because we built it mainly for folks in the US, but you can use it if you're abroad. Just understand that it's not like fully built out to your specifications yet. And you'd have to manually upload your records as opposed to being able to sync them electronically. We don't have electronic sync for folks outside the US yet. If you're within the United States, you can use this and the record sync should work for any state in the United States. The only things that would be limited to folks who are not in the states that Rhythm providers are licensed in is you wouldn't be able to necessarily get like the medications, the labs, or the consultations through the service offerings. So only stuff that we would be like prescribing for you and stuff. If we do that, you have to be in one of the states that we're licensed in. But otherwise, you can access the AI component, the roadmap, the chat from anywhere in the US. All right.
Data is safe, you sell my data.
And then is my data safe? Do we sell your data? No, we don't sell your data to anybody. We've got arrangements with there's partners we use, but when we say partners, they are partners that help us run the system. So for instance, there's a encrypted HIPAA compliant cloud server that we use to store data. And that every single partner we work with to help the system actually run is under a HIPAA agreement called a BAA. And we send everything is encrypted bidirectionally in transit and it's stored encrypted as well. So it's HIPAA compliant all throughout the chain. And I think we're coming up on time. And let's see, I know there's more questions in here, but I also don't necessarily want to run over our time. I want to be conscious of everyone who's on the panel. Thank you guys so, so much. All of our panelists, to Eliana, all of you guys, I know your energy is so precious. Thank you for spending it with us here today. I really, really appreciate you guys. And thank you so much to all of you who attended. I really hope you try out the platform. Please give us your feedback on it. We'd love to hear your feedback. We really do read all the feedback and the support tickets frequently, and we've already made a lot of improvements to the platform based on feedback from everyone. So we take it seriously, and we really do try to improve the product based on what you say. So yeah, with that, we are at time. So thank you guys all so much, and have a wonderful rest of your week, and take care, everybody.